Betty, you're being discharged with Coumadin today. Do you have any questions for me?
Oh, well, my caregiver and daughter will be here any minute. They just ran to the gas station. Do you think you can wait a minute? They understand this stuff more than I do.
Oh, well, that's okay because I have a pamphlet here. It has all the information on it. So just read it over and call your doctor if you have any questions, okay?
Oh, wait a minute. I have this right here. I don't understand. Can you
Betty, I'm really busy today. I'm in a big hurry. I have a lot of patients. So just read it over, call the doctor. Oh, and call the receptionist about your follow-up appointment, okay?
Okay.
Hi, Mom. Has the nurse been in to see you yet?
Yeah, she gave me this, but I can hardly even read it. I don't understand this.
Is she going to come back and explain it to us?
I don't know. She was in a big hurry, and I don't know. So she said talk to the receptionist, so I guess we could leave.
Okay, so let me just leave that.
Hi, Betty. I just have some information for you before you're discharged today, okay? And I'm glad to see you brought your daughter along. And hi, you must be the caretaker.
Hi, yeah, I'm Erin.
Nice to meet you. Okay, Betty, so you came to us a few days ago because you were experiencing atrial fibrillation and your doctor has now put you on Coumadin. So I just want to give you a little bit of teaching about that. Coumadin's an anticoagulant, which means it's going to thin your blood. Can you remind me what you remember from our teaching on atrial fibrillation?
That my heart quivers and it just doesn't pump blood like it used to.
Right, and so our biggest concern with that is that a clot could form when it quivers, and that could lead to a heart attack, a stroke, or it could even travel into your lungs.
I wouldn't want that.
No, I wouldn't want that for you either. But like with all medications, there are some side effects you want to be aware of. The biggest one with this medication is bleeding. So if you get a cut, you might notice that it takes a little bit longer for that bleeding to stop, and you might notice some bruising. But if you don't remember an injury that caused each one of those bruises and you're noticing a lot of them all over your body, I want you to give the doctor a call. And then you might notice some bleeding that occurs in your gums and in your nose. And that's okay as long as it doesn't occur too frequently and it doesn't take a long time for the bleeding to stop. But if you notice it does, I want you to give the doctor a call. And then there's 3 very important things to remember, and that is that if you notice blood in your urine, in your stool, or in your vomit, I want you to immediately call the doctor. Okay? So now tell me, Betty, how many pills of Coumadin are you going to take each day, and when will you take them?
I'm going to take 1 pill in the morning, once a day. And can I have breakfast after I take it?
Yeah, you can have breakfast, and the only dietary restriction is that you don't want to eat more green leafy vegetables than you already do in your diet, because those green leafy vegetables contain vitamin K, and that could interact with this medication. Okay.
Is it okay for her to still have a side salad at dinner?
Yeah, that's okay as long as that was part of her normal diet before she was on this medication. So now, Betty, I remember you telling me that you don't drive any longer. No? So, Erin, will you be taking her to her follow-up appointments?
Yeah, I can, as long as I know in advance. What will we having done at the appointment?
So at her follow-up appointment, she's going to have blood work done, and we're just looking at her INR to make sure it's within the therapeutic range. The INR tells us how long it's taking for her blood to clot, which is what this medication does. So if it's not within the therapeutic range, we would just have the doctor adjust her dosing.
Do you know if Medicare will cover this follow-up appointments and all of her medication?
Do you know, I'm not 100% sure on her Medicare coverage, but I can talk to the discharge planner on our unit and get you that information before you leave today.
Okay, thanks.
Yeah, no problem. Does anyone have any questions? No? Okay, Betty, before I leave, I want you to remind me, what's the major side effect of this medication?
Bleeding?
Yep, and then what are the 3 times that if you notice bleeding, you're going to call the doctor immediately?
If I see blood in my stool, urine, or if I vomit blood.
Right, good. And everything I just taught you today is laid out in this paperwork for your reference, and our phone number is on here too. If you do have any questions, feel free to call us. Okay, guys?
Okay, thank you.
Alrighty.
Thank you.
Bye-bye.